once you have donated one kidney, what happens to you after that? Are you going to be one of those candidates who will end up with kidney failure? You've got a long way to go still in life. So will you end up with kidney failure as well? And also, will it affect your quality of life? Maybe can you get married? Can you have children?
Specialist Centre isn't your typical hospital. It's Malaysia's premier quaternary hospital where rare, complex and next-level care comes to life. This is Quaternary Care, where our team of trusted super consultants are here to take on your toughest health battles using advanced technology and research-backed treatments all under one roof. Now, back to Nadia Azmi for UMSC's QRATED podcast.
Hi everyone and welcome to QRATED, brought to you by Specialist Centre or UMSC. Today the topic will be a combination of medicine and morality. And the question that I want to ask all of you is, would you give a kidney, we have two, but would you give a kidney to save someone's life? Now, we often take our kidneys for granted when something goes wrong, and that's when we pay attention to what's going on. And now we see thousands on dialysis and very few receiving the transplant that they need. Now it's time to talk about science, systems, and according to the title that I mentioned just now, we're going to talk about sacrifice. So today in the studio, we have two guests, two incredible experts who will be talking more about sacrifice and so forth. So we have here Professor Dr. Lim Soo Koon, consultant nephrologist. Welcome to QRATED.
Hi, morning.
Morning, yes. And next to you, we have Professor Dr. Shankar Kupusamy, a consultant urologist. Welcome to you as well.
Good morning, and thanks for having me.
Yes, are you both excited to be talking about this topic? I know it can get dark and, a little mysterious, but we are here to spread awareness to, whoever you are, whether you're, from the younger generation or the older generation. I think this is something that everyone needs to pay great attention to. Kidneys, we have two, but do you know that, we can still live with one? Okay. No judgment. Maybe some of you didn't know that, but we're going to go more into that. The first question, though, we want to know, as usual, can you just explain to us, maybe I'll start Prof. Lim, about what our kidneys do? I mean, it's one of our organs, basic organs that we have in our bodies. But when we talk about the anatomy of our bodies, the kidneys are very important. Why do we need them?
Yeah, I would say the kidneys is a very wonderful organ. So many function, in addition to the one that usually we know excreting the waste product and producing urine. The other function including regulation of our blood pressure, balancing our electrolytes, and also secreting certain hormone that can help with our red cell production, and also activating vitamin D. So you can see that there are many functions of the kidney. So you can also imagine that if the kidneys are not functioning, that what kind of a complication we might end up.
Wow. Okay. Yeah. So we do need our kidneys. I mean, we have two. We can still function with one, right?
Yes.
But it's something that our bodies rely on a daily basis heavily.
Correct.
Right, Prof?
Yes.
Okay. Prof. Shankar?
So just following on from what Prof. Lim said, once the urine and the waste products are formed in the kidney, it has to come out in the urine, isn't it? So it has to drain down through a tube called ureter.
Okay.
Then it is stored in the bladder. When the bladder is full, you get the sensation to pass urine, and then, the person actually passes the urine.
Yeah.
And this sensation is very important to not hold urine too long. You can't hold urine from morning till night. That is not so good. Yeah. So we must ensure that the urinary system is not obstructed.
Okay.
So that is where it is important to actually micturate and get the urine out of the system.
Yeah. So when nature calls, we have to rush to the loo. We have to do what we have to do. But when do we ever think about, okay, this is our kidneys at work. This is why we need our kidneys. That's why our organs are important. We never would think about that when going through all of these, normal daily stuff in life, right? Are we seeing actually kidney failures affecting more and more young Malaysians in particular, if we look at the data and statistics?
If you look at our dialysis registry,
Okay.
if I can quote you, in 2023, we have about 21% of those people who have end-stage kidney disease. That means they go into dialysis. Their
Okay.
age is actually less than 45. So, and look at for the past 10 years, this statistic has not changed that much.
Okay.
Right? So you might have an impression probably not younger people having kidney disease, but the important fact is you look at the average age of them entering dialysis is about 57 for Malaysia.
Okay.
And this is much younger compared to many other countries
I
like
see.
Taiwan, Japan. So you can imagine if this is a chronic process that people may take 10 or 20 years to become end-stage kidney disease, that means if they end up end-stage in 57, the disease probably start around 30 plus.
Wow. Very young.
Right. Yeah. And if you look at the other side of the story is that people have done some survey in Malaysia looking into adolescent school children.
Yeah.
And then comparing to 10 years ago, whereby those people with the low kidney function, abnormal kidney function at that age, it was only about 6% back in 2014. But in the 2024, when they reported the figure, it became 40%. So that basically, in a way, answer your question,
Yeah.
saying that yes,
Actually,
we
yes,
are
yeah.
actually seeing more younger people
Yeah.
actually having kidney disease.
Should we be worried, Prof. Shankar?
Of course, we should
Yeah.
be worried, isn't
Yeah.
it? Because the most important thing is we shouldn't reach until, kidney failure to seek treatment. We should talk about prevention, actually.
Exactly.
People should not go into kidney failure and then be bogged down with all kinds of treatment options for kidney failure patients. So I think we should talk about prevention. That
Okay,
is more
of
important
course.
in the context of kidney diseases.
Yep. I think a lot of our viewers are maybe wondering, we're talking about kidneys and we have two different experts right now. You are a nephrologist and you are a urologist.
Yes, sir.
We want to know the difference, what your roles are and how do you come hand in hand. Can I start with Prof. Lim?
So in a simple term, nephrologist is kidney specialist.
Okay.
So we are physician.
Okay.
So we don't do operation.
Oh, okay. All right. Okay. You don't get invasive.
Yeah. So I'm the surgeon.
Yeah.
Yeah. So I operate on any part of the urinary tract, mainly diseases that affect the kidney, the urinary tract called the ureter,
Yeah.
the bladder, the prostate,
Yep.
and of course men's health. The one that, all men will be very shy to talk about.
Yeah, yeah.
Any condition that requires surgery in this area, that is where I come into action actually.
Yes. So if people have issues with their kidneys, they will see a nephrologist first, such as you, Prof. Lim.
Yeah.
And then if it ends up that they need to go into surgery, that's where Prof. Shankar will come
They will
in.
be referred to us, yeah.
And then of course, you both need to talk to each other because you need to know the condition of the patient, what the patient needs, and so forth, right?
Yeah, that's right. That's why we come together today.
Okay.
We're always together.
And also when we talk about a kidney transplant, that's where you also come in, Prof. Shankar, right?
Yes.
When you say surgery, I mean, there are different kinds of surgery. It's not just a kidney transplant. Maybe you can elaborate a little on that.
Okay, kidney transplant is a big undertaking. It's not a individual sport. It's a team sport actually. So once the patient or a renal failure patient has been worked up by our nephrology colleagues like Prof. Lim, and then they will be referred to us to conduct the surgery.
Okay.
So what we do is we have a team who needs to retrieve the kidney from the donor,
Yep.
and then another team who will implant the kidney onto the recipient.
Okay.
So that is our job. Of course, technically not as simple.
Of course.
But in a nutshell, that is what we do as surgeons for a kidney transplant procedure.
Would you say that kidney transplants are quite rare in Malaysia? And if it is, does that translate into the fact that we do not have enough donors right here in the country?
I think we potentially have enough donors actually.
You think so? Yeah. Okay.
The thing is, the concept of renal failure treatment equals, is it dialysis or renal transplant? So I think the concept of people's thinking should change to renal failure equals renal transplant. That should be the.
If you can explain also renal failure, what that is.
Okay, if you look at renal failure, people will usually go to dialysis, right?
Okay.
People will go and for continuance of life, they need to be on dialysis.
Renal failure, in essence, is kidney failure.
Kidney failure,
Okay.
kidney failure.
Okay.
So when you have kidney failure, people will always go into dialysis to sustain their life.
Yes.
But this concept needs to change. When I mean change, when somebody has got kidney failure, it should be kidney transplant. Okay. So why? Because the cost of doing kidney transplant may be higher in the beginning, but in the long term, I think being on dialysis is probably more costly, right? Probably.
Yeah, definitely.
Yeah.
Definitely.
Oh, okay.
Yeah, because you know that when you do dialysis, every year, the subsequent year, the cost is actually increasing because you have to deal with all the complication arise from long-term dialysis. But for transplant, the initial cost is higher, but with the subsequent year, it's actually coming down with time when you go into the maintenance phase.
Okay.
Yeah.
Okay. If I'm understanding this correctly, does that mean that more Malaysians are opting to do dialysis instead of going for a transplant when actually they do need one? Is that the case?
Yeah. So if you look at we have more than 50,000 of dialysis patients in Malaysia. So I think I would say majority of them will do long-term dialysis. Only a small percentage will have a chance to do kidney transplant. Of course, various reasons.
Well, why?
Yeah.
Why does that happen? Why is that the case?
So if you look at, if to answer this question, we have to understand what type of transplant we are talking about.
Okay.
So essentially, we divide our transplant into two based on the source of the donor, where the donor come from, right?
All right.
So one is living donor. That means living people donate one kidney to the patient.
Yep.
The other one is called deceased donor. Deceased donor, we are taking from a patient who have actually had brain dead. Then they actually willing to do organ donation.
They're pledged already their
Correct.
organs
So the kidney
before.
is one of the organs they can actually donate. So these two, if you look at the country worldwide, most country doing a lot of transplant, they are actually, majority of them are deceased donor.
I see.
But
What about
in
in Malaysia?
majority is actually living.
I see. Why do you think that is the situation right now? You did mention, Prof. Shankar, that you don't think that Malaysians are hesitant when it comes to donating their organs, including the kidney. But is there any truth to maybe our culture or maybe families stopping or discouraging one from donating their kidney?
I think generally speaking, maybe there is fear. There is misconception.
Yeah.
Yes, there is cultural, racial, religious reasons as well. So fear, let's talk about fear. People may be, the donors, the living donors, might be in fear of undergoing surgery. Surgery is a big undertaking, for somebody to go through a major operation.
It's daunting, thinking you're going to be pushed into the operating
look at
theater.
the OT lights in the clinic,
Yeah,
So,
we see enough on TV already.
Correct. Yeah. So some people might be in fear of undergoing surgery. And then, once you have donated one kidney, what happens to you after that? Are you going to be one of those candidates who will end up with kidney failure? You've got a long way to go still in life. So will you end up with kidney failure as well? And also, will it affect your quality of life? Maybe can you get married? Can you have children?
Yeah.
So you don't
all
know.
of that plays into their minds.
Plays into your mind. So you need to create awareness that all these are non-existent fear. And of course, for the deceased donor part, there may be a lot of religious misconception.
Okay.
We have a lot of all our religious heads have already advocated that kidney donation it's acceptable in all religions actually. Yeah?
Acceptable and noble thing to do.
It's a noble thing to do. It's a life-saving thing to do. As long as there's a consent, we should be encouraging people to come forward and donate upon death.
Yeah.
However, there's also the misconception of body mutilation.
Body mutilation.
Yeah, because when somebody is deceased, confirmed deceased, and then you would like to procure the organs for kidney transplantation or any organ transplantation, there's always the fear or the
that you're ripping the body apart,
a lot
right?
of people may be thinking that we are going to desecrate the body, and it's not acceptable for some relatives of the deceased person, you know.
So that's why we're having this platform and this conversation. We want to help people overcome that fear or maybe dispel any myths or misconceptions that they have. Maybe if you can illustrate, maybe not too detailed, but illustrate the process of a kidney transplant procedure. What would one have to go through if they were to donate one of their kidneys?
Okay. I think it all begins with Prof. Lim.
Okay, Prof. Lim.
Yeah.
Yes.
I think
What happens first?
Yeah. The first step is by Prof. Lim's
Okay,
team.
before I answer that, probably I'll just add a little bit to what Shankar has mentioned about the reason why our donation rate is low.
Okay.
Of course, we have to separate the issue of living and deceased donor, right? So I think one of the things that he mentioned about the deceased donor, if you look at the statistic, most of the cases where it was not successful is because of family refusal.
Okay.
Because you know that even though certain people pledge for the organ, but at the time, family is the one going to make decision.
That
Right?
happens a lot, quite often.
Yeah, because in our system, we are opt-out system. Opt-out system means you basically can actually pledge for it. But when it comes to the time when somebody suffer from brain dead, he cannot make decision anymore.
Yeah.
Right? So it's back to the family.
Okay.
Yeah, family to make decision. So a lot of time, why family actually refuse, I think one of the reason is because they are not prepared.
Yeah.
They are not prepared. So some of them, the family may not be informed about this particular person actually pledged for the organ. Right? So one of the important things that we actually often educate the public when they come forward as an organ donor is you have to have discussion with the family and inform them about your willingness to actually pledge for as an organ donor when you want to sign up the card.
Yeah.
That's actually very important. So if you don't actually have that kind of a process happening, when it comes to that difficult time, we can also understand family will be very sad. So if they have not been prepared before, they will say no.
Right. Right.
Yeah. So this is actually one of the important public education that we are advocating. Any young one who come forward to actually pledge as an organ donor, we tell them, please discuss and inform your family members. You actually sign up for this so that they are more prepared. Of course, there are many other kind of factors, you know, like religious, cultural belief, you know, and a lot of all this field. But I think if we can actually do this well, it can cut down a lot of cases where family refuse.
The family refusal is the most common one.
Correct.
I see.
Yeah.
Okay. So maybe we can normalize having these open conversations with our family members. If we have pledged or registered to be an organ donor, let them know,
Yeah.
we also have to be prepared for whatever is to come in our lives and all that. So it's something that we want to normalize, having to sit down and tell your family members that you are okay with this. You will be at peace with this.
Yeah.
Right. So let's go back to that procedure that's involved when there's a kidney transplant. What happens first, Prof?
Of course, kidney transplant is always a process. Yeah. So probably we talk about the living donor first, right? So a lot of time when somebody want to do transplant, you expect the donor recipient come forward for us to do a counseling session, explanation to them what the procedure involve, and then how long it will take and all this thing, what is the cost involved and all this thing. So after they understand that, then of course, if they agree to go ahead, then we will do the first step of evaluation to make sure that they are healthy. It's okay to proceed with other investigation. So after we go through that, then of course, the transplant workup process will start, where we do more detailed evaluation.
Okay.
Yeah. So, and then of course, that process, a lot of time will take about 3 to 6 months.
Wow. The evaluation process alone.
Correct. Because it involves a very detailed evaluation of both the donor and recipient.
So a lot of tests will be conducted and you have to wait for the results to come back.
Correct.
Make sure that the individual or the donor is in pristine condition.
Correct.
Okay.
So that's why when Prof. Shankar mentioned saying that some of the donor might have a fear that they might themselves end up with kidney failure after donation, right? So that's why I always tell the patient it's a responsibility of a nephrologist to make sure they are a healthy donor before they are allowed to donate. So if we do not actually think they are a healthy donor, we will tell them very frankly that you may need to look for other donor. You yourself is not suitable.
Okay.
So this is to make sure that those people who have donated, they do not end up with kidney failure themselves. So this is a very important process. That's why the evaluation is very detailed. So when we talk about like so-called whether the kidney is healthy, we are not happy with just a blood test showing that it's a normal kidney function. We'll subject them to a very detailed measurement of their kidney function.
What's the minimum age to become a kidney donor?
There is no so-called minimum or maximum age. So essentially, we are talking about general health. So even though we say that general cutoff is 65, after the age of 65 is going to be a case-by-case basis.
Yep.
We have done donor of 72 years old before.
Okay.
Yeah, a mother who donated the kidney to their daughter.
Right.
Yeah. So age is not the main factor.
What about the youngest patient that you have heard of?
Of course, a young patient or young donor, there's some special consideration. So normally we probably will take 18 and above.
Yeah.
But a lot of time when we deal with young donor, we have to give them an important concept, which is called lifetime risk.
Okay.
Lifetime risk means if you donate at the age of 20, let's say you live until 75. So 20 to 75, 55 years. So you have to live with one kidney for 55 years. Compared to someone who is 50 years old and donate a kidney and live to 75. So about 25 years.
Yeah.
So I often ask my students and say, between these two, who do you think have a higher lifetime risk of getting their kidney into trouble? So most of the students will understand that. Of course, those people who donated at young age, definitely their lifetime risk is higher because the time is longer.
Yes.
And you will not be able to predict what will happen ahead, right? So that is an important concept that we want to give it. So we are not stopping them from donating, but we actually want to tell them saying that, yes, you can still donate if you want to. A lot of time they want to donate to their parents, right?
Yeah.
So you can, but you have to take that into consideration, lifetime risk. So normally in the family, if they do have other potential donor, we will encourage them to consider other donor.
Okay. We want to go more into the journey of a kidney donor. But before that, back to the procedure or the process that we were talking about. Let's say 6 months have passed, evaluations have done, and everything is good to go. The green light is being given to do the transplant. Then it goes to Prof. Shankar. Or not yet?
Most of the time, we will have a team discussion. And that is the important part of it, because from our perspective, the patient might be suitable or okay, right? But the surgeon have to give their opinion. The anesthetist have to give their opinion whether they think the risk is too high. So that's why we do have a multidisciplinary team discussion before we move to the surgery part. So that is actually one important step, for us to actually come together and have a discussion.
Of course, yes. It's a big deal. So that's why a lot of people are involved.
That's why I say it's a team sport.
Exactly, yeah.
So then the multidisciplinary team meeting happens.
Yes.
Where the nephrologists, the surgeons, the anesthetists, sometimes the radiologists will be present to vet through the case and to analyze whether there are any technical difficulties, to anesthetize the patient. Because it's a pair now. We're talking about a pair, a donor and a recipient.
Yes.
So and look at all the possible complications. And also the selection of the kidney process takes place, which is technically more challenging. So we need to assess. We've done more tests to assess which is a better kidney, better functioning
right
kidney,
or left,
the right or left. Because there are two, right? So you need to decide whether you, as a surgeon, together with the nephrologist, we decide whether we want to take the right or the left.
Yeah.
The right one is always more challenging. So we always prefer the left, but it has to be functionally. We do not leave the weaker kidney onto the donor because he or she has got a long way to go. So we would prefer to take the weaker kidney from the donor and implant it onto the recipient.
Okay.
But of course, we have technical challenges in that as well. So all those investigations that we do is to take us towards, help us make the decision on which kidney to be selected.
Right. So when the donor enters the operating theater, it's pretty much a straightforward procedure to remove the kidney.
I wish.
I'm looking at your expression.
I wish it is as straightforward as you are mentioning it. Sounds so nice to hear. Straightforward.
I think that's perhaps, I'm assuming the number one fear would be when you're actually going into them, cutting them open.
Yeah.
And that's where the fear comes in.
Like I said, we have two teams. One is the donor team and then we have the recipient team. So the donor team performs the retrieval operation, starts first. And we do it laparoscopically. It's minimally invasive. That means Laparoscopically means it's keyhole surgery actually. So the donor actually recovers faster, can get back to work faster, can get discharged.
And this is because of technology, right?
Because
We're
of
able to do
technology,
this.
Yeah, so it's all keyhole surgery now for the donor. And then once the kidney is retrieved, we do some process to preserve the kidney for the duration needed to implant onto the recipient. But the recipient surgery is done open. It's not keyhole anymore. It's done open. There are some technical challenges there as well. So it takes like 3 hours to perform the recipient surgery.
Okay.
Yeah, so I wish it is as easy as you mentioned. But it's not so easy because sometimes things don't go as expected. So
I see.
we do have problems intraoperatively. Can be anesthetic problem, can be a surgical technical problem, but
generally, things do go as planned.
Generally, usually it goes to plan, because of the hard work of our nephrologists in matching the patients absolutely to the point. Actually.
Yeah. Typically, how long would a donor have to stay in the hospital post-surgery?
Donor usually stays for 2 days.
Okay.
2 or 3 days after the operation, they go home actually.
Okay.
Yeah.
Just after 2 days. Let's go back to the journey of a kidney donor. You gave that comparison between someone who's young and have the full life ahead of them and someone who's already maybe in their 50s and maybe the lifespan is only until 60 or 70 plus. Can one truly live a healthy life with just one kidney?
Of course, the simple answer is yes. Yeah. So generally, I'll probably test you. I give you a test. We have 2 kidneys, right? So when we donate 1 kidney, what is the remaining percentage of the kidney function you might have? You have 2 initially, you give 1. So how many percent you might lose in terms of the function of the kidney?
Okay. This is math, right?
Yeah.
Okay. Of course, I'm not going to get that.
There's a logical answer.
I mean, 50-50, right?
So the logical answer is...
Okay.
you gave the logical answer there.
Yes,
So that's good.
So,
but I know that's not the answer.
So people might think that is 50%, right? Because you actually divide by 2.
Yeah.
But the actual process is actually not, right? So you probably lost about 30% of the kidney function. The reason is because our body is very clever. There's something called a compensatory mechanism.
Okay.
That means the remaining kidney will just compensate to be enlarged.
It works harder.
Yeah, to take over more function. So eventually people lost about 30% of the function. So that is very important to understand. So that's why we take a cutoff a minimum about 80% to allow people to donate. So if they lost about 30%, they are still reasonably healthy. We can still make sure that they don't end up with kidney failure in the long term.
If I do my math correctly, if it's not 50-50, does that mean 30% you minus from that supposed 50?
No. If you yes, you talk about 100%, right? 100%. If you are starting with 100%, you will be remaining function will be 70% after donation.
70%.
Yeah, because you lost 30%.
Okay.
Meaning 100%.
Okay.
Remove 50.
Yes.
So you got 50%.
50%.
This kidney works harder to make up for the 20%, 20 to 30%
that was lost.
Yes.
Yeah. So
maybe you got to do some graphics for that.
So that is actually the kind of beauty of our body system. Yeah. So it can actually compensate, can actually try to actually cover for the loss in terms of the organ.
Natural.
Yeah. So that's why the initial assessment is very important to really make sure that this particular person who want to donate, they do not donate with a very low baseline function.
Okay.
Yeah. So that we take a general cutoff of 80. But of course, we do actually take into consideration some special condition. But general principle is 80 for most of the hospitals.
Okay.
Yeah.
Let's go more into the fear that we mentioned about among potential kidney donors. What are the myths or the misconceptions that you come across in your patients when it comes to donating their kidney? What are they really afraid of?
I think Shankar touched a little bit on that. Besides they themselves going to kidney failure.
Yeah.
The other one is about those lady who want to donate, whether they can still get married and get pregnant or not, right?
Some people actually think they have a correlation.
Yeah.
But does it?
Yes, there's some difference in terms of like, let's say being a kidney donor with just single kidney. if they are young enough and later on they go into pregnancy,
Okay.
the risk actually increase a little bit in terms of them getting a high blood pressure during pregnancy. Yeah.
Interesting.
Yeah. So it's not a kind of a barrier for them to donate, but they have to understand that. So that's why when we actually deal with young donor, besides telling them the so-called lifetime risk, we also will tell them saying that you are a lady. So if you are in the future, you're going to get pregnant, being a kidney donor, previous kidney donor, your risk of hypertension, that means getting high blood pressure, is slightly higher during pregnancy. So that basically remind them that they have to be under a very close follow-up of the ONG specialist as well as a kidney specialist during that time of pregnancy.
Okay.
So they shouldn't think that they are just like normal people. They can just don't see the doctor and go naturally into delivery. So we have to actually put them under very close surveillance.
So after donating a kidney, you really have to pay closer attention to your health because the risk is essentially actually higher of
Slightly, I would say slightly. But if you look at the lifetime, right? So if let's say somebody donated the kidney, and what's the risk of them getting kidney failure? Essentially, it's less than 1%. Less than 1%.
Okay.
Yeah, but
Okay, listen, less than 1%.
so, but we are not talking about zero, right? So
Yeah.
zero. So that's why the close monitoring for early detection of problem is very important. And this is something that we always remind our kidney donor. But the fact is, many kidney donor might not come back for follow-up. They think they are healthy.
Yeah, they always think
Yeah.
they're very healthy.
Yeah.
How long of a follow-up do they need to
We advise them for a long term, but they do not have to come back very often. Just once a year.
So,
Just take it as a medical checkup.
Yeah. Anyway, we have to do that.
Correct.
Yeah.
Yeah.
Okay.
I will tell you about another myth.
Yeah.
Just touching
You wanna know?
deceased donor.
Okay.
Yeah, I had a patient actually. Maybe
Okay.
if I can share
Yes, of course. We wanna
real
hear.
story, So I had a patient whose children among siblings, they had renal transplant, kidney transplant performed by us, and the mother, she wanted to pledge her organs, upon her death and all that. So she was very interested. So she was asking me, her concept was of organ donation, disease organ donation. She was thinking that when she dies at home and all that, during the funeral services that is going on, somebody will come because you have pledged your organ.
Oh.
Somebody will come to your house and,
During the funeral procession.
so she was very worried about that. I think a lot of people are thinking that is what disease donor organ pledging is all about, So I think our audience should actually understand that, disease donor happens only when the death happens in an ICU setting in the hospital, not at home, where we don't have the hospital authorities coming and disrupting the funeral and retrieving organs and all that. That doesn't happen.
So what happens when someone does die at home? They've already pledged their organs. What happens next?
Nothing happens. We can't procure the
Even if
organ.
they've pledged.
No, yeah,
Yes.
yeah.
Because you have to understand that if your heart already stopped, no more circulation to the organ, or the organ fail.
So those,
In a
So
very short time.
it's no good, no use.
yeah,
No use.
even if you're a organ pledger, any deaths happen outside. That
Okay, I never thought of that. So it's mostly, patients who are very terminal in the ICU.
in the ICU.
They are the potential donors once they have
Correct.
passed on.
Yeah.
Oh.
Yeah, so that's why we just now mentioned about brain dead, right? So brain
Yeah.
dead is a concept where the brain has already lost the function, and in medical term, is equal to death, right? But because of the brain dead, but the heart is still pumping.
Yes, yeah.
Yeah, so it keep the circulation going.
Okay.
So that's why you can still talk about organ donation. But if your heart already stopped, then eventually you lost all the function.
Yeah.
That's why I think education is really important. We want to spread that awareness. We constantly have to give out all this information so people will not be misinformed, especially now with social media. People could be spreading false information that's not accurate regarding, especially when it comes to one's health. I'm sure a lot of young Malaysians who are watching us, Malaysians are already very generous in general. And maybe there's a lot of young ones out there who want to have that desire to pledge their organs. But maybe they're a bit scared because of their upbringing, who is not so encouraging of such a procedure or of such act. What would you have to say? What are the small steps that they can take? The first small steps that they can take towards achieving this? Or maybe how can they start conversations with their family? Who wants to take this first?
I think the very first thing that I would advise is they probably have to focus on their kidney health, right?
First and foremost, focus on yourself first.
Yeah,
Yes.
before you talk about donating, right? So you actually have to focus on your own kidney health.
Yeah.
So and you can observe that we are using the term health rather than kidney disease. Yeah, because now we want to shift the focus to prevention, right? So kidney health is the right term rather than talking about kidney disease. Because a lot of time when kidney disease happen, it might be too late. Damage has been done. And that's probably the very first point. The second point is I would actually say get more exposure in terms of all these if you are interested in kidney donation, organ donation, probably get more exposure to the activities and information so that you get the right information. Then only you can make decision and say whether you want to come forward as a pledger.
Okay.
So if you do make that kind of decision, then communicate with the family.
Okay.
That would be the third advice, and talk to the family and make sure that the family understand this is your decision and why you want to do so. So that because eventually the family is going to make decision, right? So if you don't inform them, even though you have that goodwill of become a pledger, it doesn't happen. So that's why we look at the statistic. Yesterday night, I just have a look at the dermal organ website. So since inception in 1997, we have more than 400,000 pledger.
Okay.
The actual happen is about 5,000, over 5,000.
And that's a combination of
everything.
The patients who are still alive and deceased?
No, 5,000 means those who already passed on and
I
donated
see.
the organ.
Oh.
Yeah, so among the 400,000,
Yeah.
you only have 5,000. And if you look at 2023 data, we have less than 100 organ donor.
Really?
Yeah.
So we do need
So the
more out
number
there.
is actually small.
Yeah. Prof. Shanga, you want to add on?
Our potential pledgers should remember that this is not only the kidney we are talking about. Okay, this is the other organs as well: the liver, the heart, the cornea, the bones. Even the skin. Can be pledged actually. And I mean, more closer to us, the kidney. If a pledger is successfully goes into procurement, we get 2 kidneys out of a pledger. An organ pledger, and we implant onto 2 patients, and we remove 2 patients from a dialysis setting.
That's such
how much cost
incredible
it saves.
thing. Yeah.
So you're giving life to two kidney failure patients, removing them from the dialysis system.
Yep.
You are giving life to a liver failure patient, a patient with heart condition. So many. This is a real noble thing to do. Actually.
Yes, a lot of wonders. It is incredible, remarkable what donation, kidney donation, organ donation in general can do. You're saving someone's life. That is a big thing. Thank you so much, Prof. Lim and Prof. Shanger, for shedding light, educating us a little bit more about our kidneys and about kidney donation in particular. I know a lot of us, including myself, we are afraid when we talk about surgeries or operations. It triggers us. Yeah. We're not doctors. Some of us can't even see blood. The sight of blood is just daunting.
It is not an easy thing to go through surgery.
Of course.
It's not an easy thing. Yeah. We do surgery almost every day of our work. And we know the fears that the patient goes through and all that. Even a simple operation, it can go south,
Yeah.
So it is our duty to allay all these fears
Yes.
and make sure the patient is comfortable to go through this surgery.
Okay.
But having taken all precautions, surgery is a safe procedure to do. It's not a big thing.
Thank you to both of you for giving us the facts and also hope And also perhaps maybe today's conversation is prompting some of them out there maybe to start that conversation or to maybe go into the website, the derma organ website, and take a look what you can do, whether this is something that you want to pursue. Because as we said, such a noble thing to do, you will be saving someone's life. Thank you so much again to Prof. Lim and Prof. Ashangar. Hopefully, it was very enlightening to a lot of us, very beneficial. And please remember to protect your kidneys, take care of your health. And it's not just about the kidneys, it's about all of our organs in our bodies. And in particular, our kidneys are very important. So yes, take care of your health, everyone.
Did you enjoy today's curated episode? Well, don't forget to tune in for the next episode of Curated Podcast by UMSC. To learn more about our consultants, specialties, or to book an appointment, visit umsc.my. For health tips, behind-the-scenes content, and expert insight, follow UMSC on Instagram, Facebook, TikTok, Spotify, and Apple Podcasts. Till next time!